Hi everyone and welcome back to The Double Dose. I'm Dr. Emily.
And I'm Dr. Raj.
And today we are talking all things pregnancy. I've been so excited to do this.
The realities of pregnancy and birth.
Yeah, because no one actually tells you the realities, I feel like.
I know, we need to really get into this one. We talk about
We
this
need to get
so much
into it.
offline. Like, I can't even cope with us doing this today on the podcast.
And the embarrassing bits. and the gross
Everything. So let's get into it.
Obviously, both of us have had children.
Yeah.
First of all, just to say, we have both experienced birth. So I've experienced 3 births and you've experienced 2. And quite honestly, for both of us, that's enough. I feel like we're
5
stopping
between
there.
us. Yeah.
And do you know what? Though, the birth I didn't mind. I would actually give birth again.
The birth you didn't mind.
No, it wasn't like. I mean, I've had 2 C-sections and 1 natural delivery. It wasn't like terrible. It was just the after bit, especially after Bell, that was quite terrible. But you had actually quite a difficult experience, didn't you?
I had some difficult birth. I mean, the first one was forceps. That wasn't great. And then the second one, I just had some really bad. Actually, the birth itself was okay, the second one. But I think
It was the after.
what came after was awful. So I had quite a large bleed and then a hematoma and everything that could have gone wrong kind of went wrong. And I think when you're not prepared for that, I think, as doctors, you do your obs and gynae rotations, you see everything, you do everything, you're very much involved in all the different cases. And I had seen a few complications whilst doing that rotation, but you never really put it down to that's what you're going to go through. So I think when I was in the scenario and it was all the alarms going off and everyone was rushing into the room,
It's happened to me.
it's happening. I was like,
Yeah.
this is it.
And then did you get scared?
Then
Or
I
did you
thought,
just
I'm-
not? You just got on with
Then
it?
I was like passing out. So I was like, right, I don't really remember much, but I'm having
my
a hemorrhage or I'm
gosh.
having a big bleed or whatever it was. And I
Did you
think
hear the alarms going?
alarms went on. Well, I saw I had blood was everywhere, and then I saw that's
Oh,
what happening, and then I
Raj.
was like, oh my god, and then it all happened. And then it's the recovery from that. I think when you get through that and everything kind of settles down, it's the emotional and physical recovery and the panic and the fact that maybe I didn't get that same kind of bonding time with my baby girl straight after giving birth because of all the complications and all those things. But I think birth is such a beautiful experience, and I think sometimes those more difficult moments within that birth experience can lead to that trauma that then can make it, you can hyper focus on just that, I think.
Yeah.
So your memory of that, a core memory of that moment, becomes related to stress
Yeah.
or trauma, and so you don't see it in a beautiful way anymore. And I think I've had to retrain myself to remind myself of the nicer moments. I have to go back to that experience, which is quite traumatic in itself, and try and remember the bit before everything went wrong, and actually the birth was beautiful, and she came into my arms, and how did that feel, and those lovely moments of it all, and try and focus on that rather than the moment after where panic set and everyone rushed in, and I thought I basically was going to die. So I think that's it. Those are the moments to think about. But yeah, I think birth, interesting is what I'd say. Interesting experience.
Do you think it's because, as I said, both of our families are
Yeah.
complete now. Do you think your birth experience is part of why you are not having any more children, or is it for other reasons? You just feel the family's complete, or
I do feel the family's complete, but I do think that birth experience definitely for me has been a major, point, like a major part of why I don't think I could go through it again. I think pregnancy. Look, I never enjoyed pregnancy, and a lot of women out there love pregnancy. It's like a joyful experience. For me, I just didn't enjoy it. I felt like I was nauseated the whole time,
Yeah, me
really
too.
sick. I couldn't eat what I wanted. I couldn't do what I wanted. I just felt tired the whole time. And I don't mean a normal kind of tiredness. I mean completely knocked for six. I just felt I couldn't get on with life in the same way. And on one hand, you're growing life inside of you. It's the most beautiful, special moment. But when you're feeling sick the whole time, or you're breaking out in rashes, or you've got pain everywhere, or I had recurrent thrush the whole time, or these things that you go through that maybe women don't talk about as much, or it's not shared as openly. Pregnancy can be tough. And I feel so guilty saying that at times, because it's like so many women struggle to get pregnant. And so when you are pregnant, it's like you should be the most grateful. But being grateful for 9 months when you're going through so much,
but you are
can be
grateful.
tough.
You're not saying you're not grateful for having your children,
Of course.
but I still think it's okay to be able to say
it's
there was some
difficult.
difficult moments.
Yeah.
I don't think there's many people out there who have gone through a pregnancy who would say, oh, it was absolutely fantastic the whole time. I had times of it that were really difficult, and I didn't have any serious complications in the pregnancy. I had one that was quite bad when I was pregnant with Belle, but nothing life-threatening.
Yeah.
But still, I was like, I felt sick all the time. I was exhausted all the time. I had loads of joint issues, especially in my
Yeah.
pelvis.
Oh
So
God,
I
yeah.
had to wear one of those really attractive
Those
like
yeah.
belts that kind of basically to just hold me together because I was just.
No one
It's
talks
like,
about that pubic
no.
symphysis pain, but gosh,
That's what I
it is
had. I
so
had that, and I had
painful.
back problems,
Yeah.
and you know, I had coccyx pain as well.
I don't know. That's the worst.
Did you have that?
Yes, that
Who knew
shooting
that was
pain.
a thing?
Like every
Basically,
time you sit all
bum
yeah,
pain.
literally up your bum.
And I was at work just sitting, you know, like obviously
Yeah.
you sit, don't you, and type a lot. I was just thinking, oh,
Can't get comfortable.
can't sit.
Yeah.
And I ended up having to sit on a hot water bottle all the time. It's just those silly things. And I had reflux and everything. I
Yeah,
had
and
Braxton
so,
Hicks
you know,
a lot.
I think pregnancy is beautiful, and I think getting pregnant, growing life inside of you is one of the biggest privileges of life. Like
Yeah.
I would have times, even through the sickness, nausea, everything else I was going through, head over the toilet, where you just think to yourself, oh God, I'm just so lucky, because you still feel so grateful that you're giving, you know, you're able to grow life and you're going to meet this baby and it's going to be part of you and your partner, and it's just gorgeous. But I think there were definitely times I was like, God, I can't go through this again. And definitely my second pregnancy, I was like, hell fucking no, like I'm done. And then the birth topped it off. So I think, you know, and I think the thing is, after you gave birth, how did you feel? Because I just felt like I'd been hit by a bus, mate. I was like, what? Especially the first time round, because I did not know what to expect. I was
weirdly
like,
lucky.
what?
First time round, I popped Millie out in a matter of hours. She was out. I think I got to the hospital and she was born only 3 hours later. And so I did most of my labouring in the car on the way to the hospital. Like literally
Did
ridiculous.
you?
Yeah, I did. Because I decided my waters broke in the morning and I was like, bit kind of like up myself really. It was like, oh,
I'll be all right.
I'm a medical student
I know what I'm
actually.
doing.
I know how this
Medical
works.
student.
And I know. Really pulled rank
You
there. It was like,
literally.
I'm a medical
What?
student and first time labour is
It took
rarely quick.
17 years, I'll be
So,
fine.
yeah. So I was like, actually, we're getting in the car and we're driving from Surrey to Somerset. So I had like a towel in between my legs.
What, your
walking around.
waters had
I wasn't even
broken?
packed. I didn't even own a buggy at this point. Okay. I had nothing. My waters broke. I packed a suitcase and me and Pete just put the stuff in the car and we drove to Somerset. And then by the time we got there, I was going, oh, actually, yeah, my tummy actually hurts now. I got in the hospital, I was 8 centimetres dilated. And then she popped out. I had not one stitch. And we went home to my mum and dad's house by, like, she was born at 3 p.m. We were home having dinner at 6.
Oh my
That was
God.
that. Having left in the morning
I
from
have to
Surrey.
envy that. I'm sorry. I have to envy that, because none of that happened to me. I remember it took forever, and I was like, you know, bouncing on.
Well, that's what I
ball.
expected to happen.
We bounced the ball. We had
I
a
wanted
midwife.
to be on the ball.
We had a midwife called Fatima, I think her name was. I was so delirious
like-
with drugs that we were singing Fatima, where are you? And she walked in. And she was like,
I'm
hi
here.
guys, did you feel that contraction? I was like, no. And Sandra and I were singing Fatima.
Did you get Sanj involved?
We were both singing, we got a video of it.
He
and
didn't
we
even
looked
have
back
an
like, what
He
the
had no excuse. He wasn't
I'm
on
bouncing
drugs.
on the ball. He's singing Fatima, and then Fatima walks in, and she's like, "You're having a contraction." I was like, "Am I? Hi, Fatima. Can you
Hi.
check me, please?" And she was like, "Yeah, 3 centimeters." It was like one of those really slow.
Oh,
And then we
that's
finally-
what I thought was going to happen.
We finally got to like 6 or 7, whatever. And I kept saying to Sandra, "I really need to go for a poo, like to the toilet." Kept going to the toilet, and then I called my sister, who's got 2 older children. And she was like,
That's the
Babe,
sign.
that might just be the baby's head. You might want to get out of the toilet and get on the bed, because you might need to get checked before the baby comes out in the loo. I was just like, can you check me, please? And they were like, yeah, you're ready to push. So it took ages. Then I had to have forceps. So it was all long. But the worst part of this, I kid you not, are those pregnancy pants, babe.
I mean, what do you mean, the disposable ones?
Don't tell me did you use
I
them?
did purchase some.
What the
It's because it was on the list.
You purchased them?
I had a list.
Did you wear
right?
them?
I don't think I wore them. I think I just wore the big mattress sanitary towel.
Can I just, sorry.
Did you not? But did you have a list? I just had a list and it was on the list, so I
had a
bought
list, but I
it.
didn't follow it. But did you actually go to
That's
shop?
the difference. That's the
this is-
difference between me and
that's
you.
me and you
That's
all
me
over.
to a T.
I had a list and I loosely followed it. I did not buy pregnancy pants. And let me tell you, they're the most.
I
If you
did.
feel shit during pregnancy and giving birth, can I
Wear
just tell you, you
pregnancy
come
pants.
out having given birth, you go into the toilet for the first time, you take your little gown off to go and sit on the loo, and then you look in the mirror and you've got pants up to here, disposable ones. We shoved like cotton wool in them.
They are a bit
And
ugly.
you telling me you went and spent your hard-earned money on that, babe? I wouldn't even get those for free.
I
Like
have
that.
got some left.
Did you wear?
still.
You got some left? Yeah, great. Why don't you wear them tonight?
I will. Pull them up to there.
I'd be.
Woo!
Yeah.
Yeah, but I just thought they were on the list. Maybe I need them.
God.
This is the thing, right? I just didn't know. I was so young when I had Millie.
One thing on my list that I never used, actually there's a few things, were, why did I buy that I didn't use? Like the little round cotton puff things, didn't use those. I wasn't sure what that was for. Cotton.
Oh, cotton balls?
Yeah.
Oh, I had like a little bowl with water on one side, like warm water.
Yeah.
And then you have the cotton balls on them and you wipe the bum with them. Not your bum, the baby's bum.
I just used water wipes.
I don't know. I just use cotton balls of water.
Oh, that's lovely to know. I'm really glad you followed the list.
I am a stickler
Have you still
for
got
a
that list? If I asked you to pull that list up now, could you get it out?
100%.
Oh my God, you're so...
Yeah, I've got the list.
Crazy.
I love a list.
You do love a list.
Because my life is chaos. If I don't have a list, everything just goes out the window.
Okay, we have to talk about this because it's so important. We talked about pregnancy, obviously, and how it can be tough and the birth. Let's talk about the postpartum era. And let's talk about physical postpartum era. So like pelvic floors. And most importantly, I know you love this topic, piles.
Yeah, but also, can I just say, you've only brought up pelvic floor because you know extremely well that I can't do pelvic floor exercises.
I have to do them because forceps delivery. Can you imagine? Like my pelvic floors are absolutely messed up.
Yeah,
Babe.
but I think mine are.
I could read right
I
now.
went to.
I could read if I like laugh maybe. So I better just pelvic floor. I'm pelvic flooring all the time, lifting, tightening,
Yeah, but
bringing up.
the problem is, Raj, if I pelvic floor, you can know
What do you mean?
because it.
Do you do pelvic floor exercises through the day?
Yes.
Do you want to try one now? So basically, you got to lift up your pelvic floors. Yeah, you need to try and do it without looking like you're doing it because you can do it all day if you're like working or whatever. If you just do it without thinking.
No, that's the point. How can you do it without thinking?
Because it becomes second nature to you. So look, listen. So you lift up, right? You're going to pull upwards. Think about your ab muscles, your pelvic floors all the way up, and then you're almost going to try and it's like you're blocking a fart from exiting. Yeah. So you're going to block up, and then you're going to slowly. Sorry.
Everyone's got experience with that. I'm sorry.
People are watching you right now. That's Dr. Emily.
Everybody has
So
experience.
they all
with
think
that.
you're like
Don't.
such a little prim and proper girly, but
Exactly,
they don't realise
that's
one
why
thing
I've got
about you.
experience.
You're stopping your farts from exiting, baby
this is
girl. On the daily. On the daily.
What are you doing? Just letting them out?
Yeah. Oh,
What?
how would you hold your fart in? That's
Wow,
great.
this is a
Right,
major
come on.
deviation on topic.
Lift up. Prevent the fart from exiting. Don't sneeze, and then you got to let it out slowly. So not the fart. Down.
Okay, hold on.
And you can breathe out while you're doing it. And you get apps for it as well now. So you get like an app, the NHS app, which kind of tells you exactly how to do it.
I can, but
Emily,
I feel like
give it up, babe. Like, and also, I think your pelvic floors are fine. Right, piles.
no. The problem is I went to what's it called? Jump. Is it called Jump In?
Oh God, I can't do that.
No, I know. This is when I realised I had a problem.
Why? What happened?
Just
Did you eat a bit?
a small amount, not like a lot. But I think that's something people don't talk about. I think that's quite common for that to happen.
Yeah, and also if you train your pelvic floors, you can actually start to get the muscles stronger, so that doesn't happen as much. But sometimes you need meds. Also, you know, this whole perimenopause or estrogenal changes. You might need some vaginal moisturizers or creams or vaginal estrogen to help with those urinary type symptoms. But
don't medicalise my
Sorry.
lack of pelvic floor right now.
don't medicalise you weeing yourself.
It wasn't a full-on wee. I mean, how many people after they've had a baby would
it's very
probably
common.
struggle to jump on trampoline? I think we have to be open about
And
that.
you've got to ease yourself into that. Like, you know, I started doing mat Pilates and that jumping and lift was just not the thing at the beginning. All working on core exercises, building that muscle up, you know, getting those core muscles
I
back
need to
together,
practice.
reducing the backache.
The problem is that you can see it on my face. That's what I need to work on. It's just a neutral poker face whilst
Doing a pelvic floor.
Yeah.
I'm doing one now, you can't tell.
No, I know.
I can tell you're trying to do one though. Piles are real, right? And they happen.
But did you use the applicator or not?
I will have been known to use an applicator from here, you know, sometimes. Lots of women do.
And men.
So, but in pregnancy, the pressure means you might be more prone
Moving
to
on
piles.
quickly.
Moving on quickly. Emily had piles and treated them very well. Congratulations.
And Dr. Raj as well.
It's common. It's common.
To be
I'm
fair-
painful as hell.
To be fair, we do need to be open about embarrassing things.
Yeah.
So why are we both embarrassed?
Because
But we are.
I don't think I'm even embarrassed. I think I was just a little underprepared for all the things that happen after you give birth. I think I focus so much on pregnancy, the birth, the baby's coming. Let's get everything ready for the baby. The nursery's got to be ready. I wasn't thinking about getting myself some pile cream, or do you know what? I might wean myself. So let's get a few like panty liners here and there. None of that was my thought process. It was all after that I realised, shit. The baby's here, but I'm just not me anymore. I'm slightly
People
different.
don't talk about that bit.
Yeah,
either.
I'm different to who I was before. Not just as a person, because you change so much when you become a mum, but I think physically your body changes, And I think I struggled because a lot of people would say to me, well, look at you, you've snapped right back. You're right back in your joggers again. But I think what's happening behind the appearance is that you might have functional issues with passing urine, with your muscles and backache, with your piles or whatever's going on. We laugh
Just so
about
happens
it,
we can talk about it because we're both doctors.
and we're friends and we talk about these things over Chinese dinners. Okay, postpartum surprises. Tell me something that surprised you.
Oh, God, there was so much that surprised me. For one, I mean, this isn't really postpartum, but I didn't know that you had to have a buggy to take the baby home. So I did not, no, not a buggy, car seat. So I did not have a car seat because we left Surrey in such a rush. And then I was like, oh, God. So my friend had to quickly go to Mothercare, which doesn't even exist anymore. I don't think that's how old I am, to buy me a car seat. So top tip, have a list with car seat on it because clearly I didn't do that. I think the biggest surprise for me was like the feeling of just overwhelming love. And also, I think I've said to you the story before, like when Millie was born and I was only 24, I was exhausted because I had a very fast, very intense, painful labour and didn't have time for an epidural or anything like that. Literally, she came and it was, they said apparently it's called Fast and Furious because it was, and she was born and I just said to my mum, I need to sleep. Like I was exhausted. I just remember lying there. There's actually a video of me where you can just see me like I look like delirious. I'm just lying there falling asleep. And after like 5 minutes, the baby started crying and my mum came to me and woke me up and was like, you need to feed the baby. And I remember being like, oh my God, like I can't just sleep when I'm tired anymore. Or I can't eat when I'm hungry. Like this person has to come before me now, always. And it was such a defining moment of like, I'm not first in my life anymore. And that never goes, does it, after you have a child?
I actually think that's so lovely how you put that. But I actually think that I mourned that a little bit. So I think I was sitting in that hospital bed and as much as I was like completely in love, couldn't stop peering over, how you do, and thinking, oh my God, that's my baby. At the same time, I was like, what the actual fuck? What do you mean I can't just get up and do what I need? Like, and like everything.
Because you are on the go all the time.
And I was like, oh my God, like I literally have to do everything. Like what is this? And I had this feeling of like, obviously in the hospital in a bit of a bubble, aren't you? And I was there for a few days because I had quite a traumatic birth. So I was there, like, had all the help. I think it was when I got home, and I was like, the first night I did at home, where I was like, oh, you're right. Like, I'm somebody.
But you were trusting me to look after this baby.
You're trusting me to love this baby. And also, I'm somebody who could sleep like literally 12 hours if I had the chance to. That was me back then before.
Wow.
And now I'm like minimal sleep running around. And that's become my default. But I think that was when it hit me. And then I kind of mourned the entire pre-existence of me as, not being a mummy Raj. So like the whole pre-era, because I was like, gosh, I remember having a moment. I think I even spoke to my husband about it. Like, that's it now. Like, I'm mum. There's so much more to me that's come now in like just literally in one moment. Baby's come and it's embellished me in so many ways. But it's also taken so much away from me, that carefreeness, that freedom. And I remember him saying, no, you're still you, you're still fun. I was like, no, but I was like, I will always be thinking about this little being, like no matter what I'm doing, even if I'm out, having a night out, having a drink, having fun, I'll always thinking, oh, but I hope, he's okay, or I hope tomorrow morning when I do this, so it's gonna be an early start, whatever it is. It's just a whole different feeling, right?
Yeah, completely different. And that never leaves you. I feel like even when they're adults, like I know now, my parents still have their phones on loud at night. And all of us.
Any of you need them?
Yeah, all of us are adults now. Me and my brothers, we're all adults, but they still have their phone on loud in case we need to ring them for anything.
I think it's that feeling of like you're going to be someone's everything, especially when they're young. Like obviously as they get older, they don't need you as much, but those early years, you're everything to them, and that's such a big responsibility and such a privilege. But also it means that you I'm not saying you become nothing to yourself, but you definitely put yourself last, don't you? I did for the longest time. I'm putting myself a
Yes.
bit more forward now, but you also lose that previous identity a little bit. You create a
I
new
think
one.
it's okay to say that
Yeah.
and not feel bad about that.
Did you feel that you lost a bit of your old identity and you've
I
created a
did.
new one?
Well, partly for me because I I still had a year. Did I have a year to go at uni or 2? I think I had 1 more year to go at uni. And so all my friends, while I was on maternity leave, carried on,
Into it.
graduated,
Yeah.
and they were all starting their junior doctor jobs when I was then going back to uni. I went back when Millie was about 7 months old, I think.
Wow.
And so I remember feeling like a bit left behind, that everybody else had gone, they'd all graduated, and they were all now working as doctors. And obviously I did then do that the next year and graduated and started work. But
Can we just take a moment to recognise that you had a 7-month-old baby
I did my final. She was 10
and
months
went
old.
to finals?
Yeah, that was. Do you know what though? Actually,
Wow.
I was so calm. I think because my priorities had so changed. And it
Yeah.
was all about the baby. It was all about Millie. I just had my priorities in order. I had like help looking after her during the day, so I knew those are my revision hours
I got it.
for like
Got it
8 to
done.
10 hours
Yeah.
max. And then I was with her, and that was fine. I actually somehow did quite well in my finals, and I wasn't stressed. I didn't because also it was a year group like that I wasn't overly familiar with.
Yeah.
So I didn't like mingle with everyone before. And you know when when you're doing your medical
Yeah.
exams, everyone's like, "Have you revised this
Oh, yeah.
topic?
That's, yeah.
Have you done this?" And I'm like, "No, I haven't, or
It's
I don't
nice
know that."
Yeah, you need to be away.
I didn't
from
do any of
'cause
that.
You hear a
I
lot
did none
don't
of it.
you? Or just about you when you're about to go into your OSCE and they're like, "Did you
you
learn the
revise this
cardiology exam?" And you're like, "Actually,
Oh.
no." And thank you for that boost of confidence.
Yeah, right.
As
So
I
I
just
did none of
entered my
that.
finals. Yeah, so it's actually helpful to have
Yeah, I was a little
oblivious.
bit more because I was so focused on her. So she was 10, 11 months when I sat at my finals.
But I also think those first months of having a baby change your life so much. You become so strong so quickly that I can almost imagine that having that tool would make you a bit more resilient.
Yeah.
Even though it's stressful, I think you'd kind of go into finals. Like, finals are your be all. As a medical student, that's it. That's your moment.
Yep.
But if I'd had a baby before that, I'd be like, no, I've had a baby now.
That's kind of
this
what
is
I
a
was
walk in the
like.
park almost,
And it was fine. I wasn't that stressed. It went better than I thought, and I got my first choice job that I wanted. So I was like,
Go you.
"This is
Go
great."
you, Emily.
It was kind of lucky because I didn't want the most popular jobs
Yeah.
used in London, aren't they? And I was thinking I don't want to be commuting into London with a baby. So I was like, "Oh, good. You can give me a job in the countryside. Thank you very
I'll
much.
take that.
I will love that." Did you know that if a child gets sunburn, it increases their risk of skin cancer later in life? So we spoke a few episodes ago about my long-term love for CeraVe. They've just launched a new sun care range for body and face that I've actually been trying for about the past month. You know what I'm like with sun care, especially for the kids. I love reading a label and I'm very diligent on protecting my kids' skin against the sun. Key for me is that this range absorbs in 1 second. Now, any mum will tell you what a win this is when you have wriggling kids that do not want to wait for sun cream to dry. As with all CeraVe products, each is formulated with 3 essential ceramides and helps to protect the skin's natural barrier alongside the broad spectrum SPF 50 protection. The formulas are super silky and hydrating, and I can honestly say this is a sun care you want to wear. They also have a little stick that I love and I have in my handbag for touch-ups. I can't recommend it enough. But
What do you think about when you've given birth and things change, obviously, like, for yourself, your body, but then even relationship-wise, like that whole comment that was made by Robbie Williams about the pub being burned down. Did you see that?
I cannot believe that. I mean, I don't even know it. So my understanding is that Robbie Williams made a comment about, I think it was about observing his wife
Yes.
giving birth, and he said it was like watching his favourite pub burn down.
I mean,
I shouldn't laugh, really. It's a great analogy just in terms of like comedy value.
I think it's like,
Oh,
look, things change, don't they? Like they do, but you just have to find your way, I think, back. And I think now, 2 children down, like well into it, it's obviously different. Like you're not gonna. I certainly didn't give birth and think, right, we're back to being the same sort of intimacy and all.
pub's open.
Yeah, pub was not open, babe. Pub was closed. Long time shop closed. Because you've got a lot of other priorities. You're tired. You might have pain. I'd had it
Or you'd had
forceps,
forceps.
So it was pub and shop was closed, but it certainly wasn't burnt down. Come on, Robbie, babes. Don't be writing them all off already. No thanks. It wasn't burnt down. It just needed refurbishment, and that's what we did.
Needed a refurb. I think maybe Robbie just shouldn't have watched the pub burning down if he felt that's how he was going to feel about it. Yeah. Maybe Robbie should have just taken the view of like, I'll stay up the head end.
Yeah.
No need to watch the pub burning down. Then he wouldn't have known it burnt down.
In his well, he might have just seen his pub door opened and then it closed again.
Yeah.
No one's burning the pub.
This sounds weird, and maybe again this came from being a doctor, a medical student, whatever, because I'd seen a lot of births, like obviously in our training. I remember thinking, I don't think I want Pete to see that. Like, I'm quite happy for him not to be involved in that. And obviously this is personal choice, right?
Yeah.
Some partners or some women are fine and would encourage that, and some don't. For me, I was much more like, I felt like he'd be better up the head end. He's also really squeamish. So I thought, I don't need him keeling over.
And also for some people, it's like you need to be in the situation to know what you feel, like whether you want to or don't want to do that. You won't know until you're in the moment. So you almost want to be like, see how you feel, but not put any pressure on them, right?
I think he was really happy when I said, I'm actually
up there.
Fine for you to be up at the top and not. And actually, that worked
to be
well
in the beer garden. Is that what you told him?
Yeah, luckily he doesn't drink, so this is great. This analogy is wasted on us. But yeah, that for us was the right decision. But when you watch someone else giving birth, quite often the partner is there and watching everything, and I've got time for that as well.
Yeah, and I think it's I think his analogy kind of leads into the fact that once you've had a baby, things are different. Maybe, in intimacy, in your communication, and how you might spend time together.
How you look as well.
How you look. Yeah, and I think for me, that's all about open communication. So you need to make sure that you're just talking about things like how you're feeling. Whenever the time feels right to go back to that or back to that intimacy, it should just be open communication.
There's no right time.
Yeah, there's no right time. And I think everyone's different. And I also think that it's okay to need the time, to need, your hormones are everywhere, your feelings are everywhere, and having a partner that's very supportive and understanding of that, I think, is the most important thing. I mean, everyone has their own personal feelings and views. I just remember feeling like I'd been hit by a bus, and I was like, no, thank you. I'm not I don't need to feel any kind of physical intimacy right now. It took me a while, but I think that communication is important, because you might be, if you've had to have interventions or, C-sections or whatever it is, it's also about the physical healing. That's also important too.
The other thing to mention, which I've experienced this in patients, is that it is possible to get pregnant very quickly after you give birth. And I think it's not something that everybody knows.
Yeah.
There is some impact of breastfeeding that can reduce the potential for you getting pregnant, but it's not 100% effective. And certainly there are people who accidentally fall pregnant before they even are coming in for their 6-week check at the GP. So actually, good point to bring up something educational. Doesn't matter if you're breastfeeding, use contraception.
Yeah. And so at your 6-week checkup with your GP, sorry, I need an itch. At your 6-week checkup with your GP, you should be having those conversations anyway. But it obviously
then as well, I think it's important.
Some people obviously will get intimate before then, and that does happen. So if that's happening, make sure you're checking in with contraception or whatever it is that you should do if you don't want to get pregnant.
Don't wait to the 6-week check.
Yeah,
and assume you'll be fine.
That is true.
Learning point.
What other points have we got here?
Okay, Dr. Raj.
Yeah.
Actually feels weird calling you Dr. Raj.
What's wrong?
Raj, should we do some myth busting?
Let's do it.
You will know you're in labour because your waters will break. Like the big gush.
The big gush will happen. That's a myth.
Correct. Only 10 to 15% of women experience their waters breaking as the first sign of labour. For many, contractions begin first. For me, interestingly, my waters did break, and that was the first sign.
Wow.
But that's not the case for everybody.
No, it's not. Okay, I've got one. We already talked about this one, so I'll leave that one out. Natural birth is better than a C-section.
I need to really quickly get the myth card on that. That is a strong myth, because there's no
universal.
No, absolutely not.
Better way to give birth, and I think that there's a lot of pressure on women. That it's better, there's this whole thing about too posh to push, but actually sometimes you have to have a C-section, sometimes it's your preference to have a C-section. It's all okay as long as it's safe, as long as the patient's coming out, hopefully healthy. And that's the most important thing. And that pressure we see on women, I think, is awful when you're going through so much already. Sometimes a vaginal birth might mean that your recovery's, slightly faster, but then you might also end up with an instrumental delivery like I had. And that again can mean that actually it's drawn out and you have to have more healing, like you may have to have with the C-section. So I don't think it is one's better than the other, and it is definitely very much tailored and case by case.
Yeah.
And I have to push that out there, because I have so many women coming in who either have been pressurized by friends or
they feel guilt afterwards.
That why did I not push, or why I did push and then this happened. And I think we need to take that pressure off women and understand that as long as you're in conversation with your healthcare professional, and as long as you've been advised and you're making informed decisions, that the most important thing is getting the baby out safely.
Yeah. And that's the thing that the doctors and midwives will be thinking of as well, is it's not just your health, it's the baby too. There's two people, two individuals to be considered. And it's about weighing that up and balancing what's the safest option for you both. And I've had 2 cesarean sections because both my younger 2 were breech presentation, and especially with Theo, because he was a footling breech, that can be dangerous if your waters then break, because the cord can come down and you can have what's called a cord prolapse. So for me, having discussed it like very carefully with the doctors and the midwives, the decision was made to have a C-section. And do you know what? It's not something I regret. And in a way, I'm kind of glad I had both experiences of a natural birth and a C-section, and now I can compare both. And there's pros and cons of each, but I definitely try not to feel guilty about it, because it was the right thing for me.
I think you're right. I think if you, especially if you have got a health issue or something to worry about when it comes to the patient, or the mum's safety or the baby's safety, that decision's very much almost taken out of your hands sometimes, because you've got like preeclampsia or something serious going on. You will be presented with the decision or the choice question mark, but really you've got to be sensible and do what's right for the baby. So I think the point is, in some situations it's an emergency, and in those situations you really need to think, well, actually the most important thing is that we got the baby out. There's so much emphasis on how we're getting the baby out, but really and truly it needs to be done respectfully, sensitively and safely. And
it's the outcome that is the most important thing for the mum and the baby.
That's it. Things we wish someone had told us, Emily. What do you wish people had told us?
Oh, let me think of an example. I did write some down. Oh, do you know what? Things I wish someone had told me. I don't know if I wrote this one down. Yes, I did. Okay, things I wish someone had told me. I did not know that you bleed for somewhere up to 6 weeks after having a baby. Okay, this is despite being a doctor. I didn't know that. And I especially didn't know that after a C-section.
Really?
Why did my brain not tell me that? It's obvious. But I didn't know that. So yes, that's where the pants come in.
That's you can. Yeah, I was going to
say use
pants now.
My
it's a bit late now, love. Isn't
it? Late now. Because no,
but
no more babies.
You can up to 6 weeks, and sometimes a bit longer.
Yeah.
At the 6 week checkup, obviously, we'll as GPs, we see the patients, we assess them, we see how heavy their flow is. We'll talk about contraception, and that's kind of when we get to talk to the patients about what's happening with their flow. And some women will have got to the point where they're pretty much stopped. Some are still heavy bleeding at 6 weeks. Some are still passing clots, although that's much more rare. So it's a conversation to have had. But yeah, you can still bleed for 6 weeks.
And don't use tampons.
Don't use tampons, for at least 6 weeks.
That was a bit of a shame when I found that one out as well.
Yeah.
But anyway.
I didn't know, and this is a really interesting one. Well, I knew, but I didn't. I knew because I'm a medical student, I've been on the job, but I didn't know before I was a medical student that you can poo when giving birth.
I didn't know this until I was a medical student. Can I tell you what happened to me, Raj?
I walked into my first one, and I remember
is this going to be
like,
the same story?
And I was like, "So what's that?"
And so I saw the net by the side of the birthing pool. This is how I found this out.
Oh yeah, they have a net.
It was a net, it looks like a little net that you might take to the beach.
Net.
Okay.
Yeah.
And I said to the midwife really innocently, "Oh, what's that for?" She said, straight down the line, "Oh, it's for fishing poo out the water." And I was like,
"Do you think she was joking?"
No, she's deadly serious. I watched her in action later that day.
So I saw it the first time I went to go and get an obs and gynae. You don't have to go to logbook. You see so many births when you're training to be a doctor as part of your training. And I remember going to my first one, and this birth was taking place, and I was really emotional because it was the first one I'd seen.
I cried.
Life, and I cried and cried, and I was just really grateful that she'd allowed me to come into the room, because I don't think now, having given birth, I'd let it sounds really bad being a doctor, but it's such an intimate moment, and I don't know if I'd feel comfortable with somebody else in the room. But anyway, this lady had allowed me to come in, and it was lovely, and I experienced this birth with her, obviously, and at the end of the bed, and this baby's head's coming out, and I'm crying, and then suddenly poop comes out, and mid crying, I'm just a bit like, I think I was just shocked. Like, is this supposed to be happening, first of all? No one had told us that this is something that's meant to be happening. So I'm looking around the room like, is something gone wrong? Is it meant to be happening? And everyone's carrying on like normal. So obviously I was like, okay, this is normal. This is what's supposed to be happening here. But yeah, poop is very normal. It's very normal to poo when you give birth.
Mm-hmm.
And people get really funny about it. But just to put it out there, that is something that midwives and obstetricians see all the time. So
Do you know what they
panic.
do as well, which I absolutely love? They handle it so
Oh, well,
discreetly.
yeah, they do,
So
they do.
obviously because it happens very, very
Yeah.
commonly, it's like the midwives just whip it away before, I even hardly saw it. The patients certainly would not see it. So they're
That's
so
true.
good about just being super professional. Quick bit of tissue or the net.
Most women
Off.
don't even realise they've done it because
No.
they're too busy. When you're pushing and you've got that ring of fire and you're pushing the baby out, who's thinking about pooing and what they're like? No one's thinking about that. Like, that's not there. But because the same muscles are working, a bit like the pelvic floors, the same muscles are working. So that's why that pressure's building up. And sometimes if you have got stool in your rectum when your lower bowel, obviously that can come out when you're pushing. So that's why.
Better out than in anyway.
Better out than in, but nothing to be embarrassed about. It's a sign that you're pushing correctly, actually. So there you go.
Okay, shall we talk about doctor's orders that we actually break?
Let's do it.
Okay, number one. Oh, I'm so bad for this one.
Can you imagine what I'm like with this one?
Yeah, you're going to be worse than me. Sleep when the baby sleeps. I mean, I do now, apart from in the day.
Yeah. It takes time because you get to a point where you're like, you realise actually it's not sensible if you don't sleep when the baby sleeps. Otherwise, because you're knackered. So in the beginning, I thought that was like, a bit of a revenge procrastination time for myself. The baby's gone to sleep. Now's the time to try and do 15 things at once. Sort my hair
True
out.
to form, Raj, 15 things at once.
15 things at once. Put things away. Like, put my face creams on, like, shave my legs, whatever it is, 15 things, get it all done in the time the baby sleeps. And you soon realise that wasn't clever.
Yeah, but Raj, the problem with this comes as well was when you have more than one child, okay? So when Millie was born, I could do a little bit of sleep when the baby sleeps. When Theo was then born and Millie was 2, I vividly remember this. I was so exhausted after Theo. I'd be like, right, I'm just going to put Peppa Pig on for Millie. Yeah. Theo's asleep for 5 minutes because he didn't sleep much. I was like, I would literally fall asleep sitting up because I'd be pretending to watch Peppa Pig. And Millie, at 2 years old, used to come up to me and physically open my eyes and be like, hi, Mum. And then I'd be like, so you can't always?
So when you've got 2, it's really difficult to do that. You need some help so you can get a little bit of a nap. But you're right. Your 2-year-old's not. My 2-year-old, no way. If she sees me falling asleep, she's like, Mama.
But also, you've got to cook and tidy up and like do the washing and stuff.
Fit everything else into schedule.
I know.
It's such hard work. Okay,
but you should sleep when the baby sleeps. Okay.
Doctor's orders that I actually break. So, that was one I mentioned before. So not knowing how to manage your child. So I think when they're ill, I think as a doctor, normally you follow certain, protocols. Or I would tell my patients or mums that come in as patients, don't worry, this is what you're looking out for. These are red flags. This is safe netting advice. All done. But when it comes to me being Dr. Mummy, all of it out the window. Emotions take over.
Though.
That emotion takes over. You're just feeling panicky. You've got this little life in front of you that you've created. You're just thinking,
Yeah, but that's exactly why, Raj, that you're not allowed to treat yourself or your family because it's very, very difficult to make a sensible, balanced decision when your emotions are so involved.
I agree.
And that's exactly why that rule.
I never used to understand that until I had babies.
I
was like, oh, this is the reason why. I get it now.
Because I can't make
any sense flagging off all the things that we're told as doctors. There's a reason why we can't do this. Totally makes sense.
Oh, God.
Okay, listener questions, my lovely. So we've had some great listener questions in. I'm going to start off with one. I'm due in a few weeks. How can I prepare for all the unexpected bits of labour and postpartum recovery that no one talks about?
Guess what I'm going to say?
I know what you're going to say, babe.
Well, one, listen to this podcast because we've said stuff that people don't always say.
Say it for 3. Let's say it for 3. 1, 2, 3.
Make a list.
How do I know that?
Make a list, everyone.
And get a Pritt stick as well.
Get a Pritt stick and a guillotine, which I have recently purchased.
I love it. Make a list. Or if you have a list, actually follow it. I didn't follow mine, but follow it. Ask friends and family who have had kids for their honest truth. I think I've found such a wonderful friendship with Emily, and I feel like it's so raw and so honest and so true that I can come at her with something and she'll give me like what I want to hear. Definitely. She'll be like, yeah, this is it. And she'll reassure me, but she'll also give me another perspective. which maybe I didn't think about, or I wasn't wanting to go there, you know, that uncomfortable sort of truth. So she'll tell me, like, you know, I know that if you'd been my friend at that time, you would have told me, Raj, you know, be careful because you might poo when you're giving birth. Or, you know, you'd be that friend that would give that
definitely
other
have told
bit of
you.
advice. So I think ask friends and family. Anything you want to add to that?
Well, I think for me, I'm a real stickler for, like, maybe I do things in a slightly old-fashioned way, but I am really funny about the fact that having a baby is so commercialized and monetized now that there are lots of gadgets that you'll be made to feel like you need that you don't necessarily need. And some gadgets are amazing, like some of the stuff that I have purchased and used for the kids, like some of the baby monitors that are around now, really helpful. Some things I think they can try and, you know, like I am one for a real simple buggy. Like I feel like they can make you feel like you need a buggy with alloy wheels and suspension, or you need all these different things when actually, you know.
Don't even ask about my buggy. Still, literally, my son is 6. It's still in the spare room and half built, thanks to my husband. So we haven't finished the buggy off. So now I'm going to try and sell it or something. Anybody wants a buggy? It's the Cybex Bugaboo.
What, you didn't use it from 6 years ago?
No, because I was like, Sandra, can you just make this buggy for me? And then he started one day, and we never got to the end of it. So I just
but you clearly never needed it.
Just use a yo-yo now. I know the other one.
So I like the ones that you can get out with one hand. Because who's got who's got a big enough boot?
Wanted, you know, I had the suspension, that buggy. I bought into all of that and then never bloody used it. So what a waste.
That's my point entirely.
So yeah, you're right. You don't fall for the gadgets. Don't spend money that you don't need to, and just, you know, do your research because you don't need everything on the market.
I never had a nappy bin, for example, but maybe I should have done.
5 or 4 around the house, and I didn't need.
Hold on, wait a minute.
Didn't even use one.
Do you have 5 nappy bins?
Okay, like 4, not 5, but in each room. I never even used.
What is a nappy bin? Is it just a normal bin?
Don't ask me because I didn't use it.
Raj, I love you.
I know.
Did you just position them in random rooms in case you happen to change your nappy?
I didn't follow the hospital list, but I had 4 nappy bins and a Bugaboo Fox buggy that I have never used. So don't ask me. I'm useless. Okay, useless.
Well, I never had one, so I can't tell you what they are either.
My one bit of advice for postpartum recovery would be that you need to make time for yourself. So even if it's 5 minutes, whatever you do to snap out of that feeling of this is just such on repeat, and you feel like you're losing your mind, talk to somebody, get on the phone to somebody if you can't see somebody in person, have that calm chat and take 5 minutes for yourself. You know, it might be that someone's just looking at the baby while you're going to have a shower, calm 5-10 minute shower, something simple and easy that's going to reset your mind, because it's very easy to be like, I can't leave, I can't move, and get trapped in that space, you know.
There's something about the shower that is somehow really calming and relaxing and soothing, and it's something that after you have a baby, for me, it was the thing that I did in such a rush. It was the one moment really for me.
Yeah.
And I always had a crying baby there, or I did it in such a rush. I mean, literally, I've had showers before in like 20 seconds. But take your time to have your shower. And you feel lovely afterwards.
I have never appreciated a shower
so
much in my life than after I gave birth.
Yep.
And I remember putting my baby girl into, you know, those docket things you can get where you put them in, and putting them outside my shower so I could see her, and then having a nice 10-minute shower. Or she's like, no, let's do whatever.
See, my children used to scream. Belle still does scream.
She could see me. She was okay. I mean, my birth couldn't do that, but
Belle just bangs on the door.
She was like, 10 months, and she couldn't. It's pre-mobile, so she was lying like in the thing. She couldn't walk. But now, the door's open. Mama. I'm standing there butt naked, like, can I just have a shower, babes? Where's your dad? But I think, where's your dad? Is he on the toilet 40 minutes again? Yep. There you go. So it's like I'm just trying to have a 2-minute shower. But take your time.
She's traumatized every time I shower. It's literally like, why are you behind this piece of glass?
I get, draw a triangle. So I'm like, draw a square. I'm like,
do you ever just push your bum on the glass to make him laugh? Please tell me you've done that.
No.
What?
Took it too far.
Oh my God, everyone's done that, surely.
Far. Okay, quickly. What's harder, going from 0 to 1 or 1 to 2 kids?
I know straight away for me it was 0 to 1.
Yeah, agreed.
Because your lifestyle change is massive. You have like all the rush of feelings and how amazing it is, but the change to your life is huge. Going from 1 to 2, you're kind of already in that flow.
Yeah.
Like I had a 2-year-old and a newborn, so I was like, I'm already doing this.
1 to 2 is like you kind of know what to expect, get on with
Yep.
it, get moving, you know, it's just going to be hectic for a while, you know, but you kind of, I think 0 to 1, I was like, what the actual helly? Like, what is, like, what do you mean I'm a mum, a mamacita?
You're so
What do you
down
mean?
with the kids.
How am I mamacita?
That was so good.
Just how? And then that was when I was like, right, I've got to take a deep breath because this is it now. This is like, we're
You're
here.
in this
we're
now.
Here. We're 0 to 1ing, you know. 2 to 3, girl.
2 to 3. I mean, I had a big gap. Theo was 7 when Belle was born. So I felt like I was out of the trenches and then like suddenly wham bam back in the trenches. So I did find that quite hard, not helped by the fact that my recovery, I had a lot of complications after she was born. I was very unwell really for quite a long time, as you know, like so I had emergency surgery and stuff when she was only a week old, so I had that to recover from, and then in amongst that trying to take 2 children to school and pick them up and go to their clubs and stuff. I couldn't drive for 3 months, so it was a lot. And luckily, thank goodness, I had really good support from my mum, my dad. Pete was great, because I couldn't have done it. I don't know how I would have actually physically got them to school because I couldn't drive for that long.
I think I have to commend you there. I mean, I think it's so hard to split yourself up when you've got more than 1 child. I think I struggle with 2, you know, and I've always thought, God, those parents that are doing 3 or more, literally, you guys are amazing. I think being a mum is amazing, you know, and
Agreed.
I think sharing that love that many ways is just incredible. So,
go us and
go
everyone out there
Go
and
us.
dads. Can we actually?
Because you
Let's
know
take a
what?
moment for the
We've
dads.
gone on and on about the mums out here, but you know the daddies are doing it too, and it's their first time, and it's hard for them, and they're seeing their wives with their pubs being burnt down, and like, you know, life's just all over the place, and we appreciate you. You might take 40 minutes on the loo at times, but it's okay as long as you show up for us. We're here. We're loving it. Thanks, guys. Hope you enjoyed that episode of the Tip Toes.
Well, that wraps up that episode. Thank you so much, everyone, for watching.
Make sure you like and subscribe if you want to see more of this, and don't forget to send your topics and questions.